Right now, there may be something sitting in your medicine cabinet, something you take without a second thought, that is slowly putting extra strain on your heart. It's not a new drug. It's not something exotic. It could be the pill you took this morning. Stay with me, because what I'm about to share with you today could genuinely change how you think about your health and possibly protect your life. Hi, I'm Dr. Adriana Markson. I've spent years working with patients in their 60s, 70s, and 80s, people just like you, who came to me not because they were sick, but because they wanted answers. They wanted someone to speak to them plainly, honestly, and without all the medical jargon. And one of the things I see over and over again is this: good, careful people unknowingly putting their hearts at risk, not from reckless behavior, but from medications they were told were completely safe. Today, we're going to talk about 5 of them. I want to be very clear from the start. I am not here to alarm you, and I am absolutely not telling you to stop any medication on your own. Please never do that. What I am doing is giving you the knowledge you need to have a more informed, more confident conversation with your own doctor. Because you deserve to be an active participant in your health, not just a bystander. Let's get into it. We're starting with one of the most widely used medications in America. You've taken it. I can almost guarantee it. I'm talking about over-the-counter anti-inflammatory pain relievers, ibuprofen, naproxen, diclofenac. The ones you reach for when your back aches after a long day, when your knees flare up, when a headache won't quit. They work. There's no question about that. And for a young, healthy person, short-term use is generally considered low risk. But here's what changes everything: age. After 60, your cardiovascular system operates differently. Your heart works a little harder. Your blood vessels aren't quite as flexible as they once were. And your kidneys, which play a critical role in managing fluid balance, are more sensitive. And this is exactly where these pain relievers become a concern. Here's how it works, in plain language. These medications work by blocking certain chemical signals in your body to reduce inflammation. That's the good part. But in doing so, they also interfere with the kidney's ability to manage how much fluid stays in your body. The result? Fluid builds up. Your blood volume increases. And your heart, which is essentially a pump, suddenly has a lot more to push through. For a 35-year-old with a strong heart, that extra load isn't usually a problem. For someone in their 60s or 70s, especially someone with high blood pressure or any existing heart concerns, that extra strain can tip the balance. There's also a blood pressure connection that most people completely miss. Regular use of these medications can raise your blood pressure, even if it's been perfectly controlled for years. And if you're taking medication to manage that blood pressure, certain anti-inflammatories can actually work against it, reducing its effectiveness. The risk increases with the dose and how long you use them. Higher doses and daily long-term use carry the greatest concern. So what's the takeaway? It's not never take a pain reliever again. It's this: if you're reaching for one of these every single day, that's a conversation worth having with your doctor. There are alternatives: acetaminophen for certain types of pain, topical gels and creams that work at the site without affecting your whole system, and other approaches depending on your situation. The question to ask your doctor is simple: Doctor, given my age and health history, what is the safest pain management option for me long term? That one question could make a real difference. Now here's one that genuinely surprises most of my patients when I bring it up: proton pump inhibitors, or PPIs. You may know them as omeprazole, pantoprazole, or lansoprazole. They're sold under brand names you've probably seen at the pharmacy, and they're used by tens of millions of Americans every day to manage acid reflux and heartburn. They're also prescribed to protect the stomach from the kind of medications we just discussed. The irony? In some cases, the medication prescribed to protect you from one risk might be creating another danger through the back door. Here's what happens with long-term use. Your stomach acid, as uncomfortable as it can feel, actually serves an important purpose. It helps your body absorb essential nutrients. When you suppress that acid consistently over months and years, certain minerals don't get absorbed the way they should. One of the most important is magnesium. Magnesium is critical to your heart's electrical function. It helps regulate the rhythm of your heartbeat. When magnesium levels drop, which can happen quietly without any obvious symptoms at first, your heart's rhythm can become unstable. We call this an arrhythmia. And in some cases, that instability can become serious. There's also an emerging concern in the research about these medications and heart attack risk, though I want to be careful here. The evidence is still being studied and debated. But the association has appeared in enough observational data that it's worth knowing about. Additionally, if you've ever had a heart attack or stent placement and you're taking blood-thinning medication as a result, certain PPIs can interfere with how well that medication works. That's a significant interaction that not everyone is aware of. The biggest issue with PPIs isn't that they're bad medications. It's that they were designed for short-term treatment, typically a few weeks, and they've quietly become something millions of people take indefinitely, often without anyone revisiting whether they still need to. If you've been on a PPI for more than a few months, a good question for your doctor is, do I still need this? And if so, are you monitoring my magnesium levels? Don't stop on your own. There can be a rebound effect. But do have that conversation. Before we get to number 3, I want to pause for just a moment. Because here's something most people your age are never told, and it's one of the most important things I could say to you today. The risk from these medications isn't the same for everyone. Age is a major factor, but so is the combination of medications you're taking. Many of the dangers I'm describing today aren't from any single drug in isolation. They come from interactions and accumulations that build up quietly over time. Which is exactly why this next one catches so many people completely off guard. You have a cold. Your nose is completely stuffed up. You can't sleep. You can barely breathe. So you go to the pharmacy, pick up a cold and flu remedy, and within an hour, you can breathe again. It feels harmless. It feels like exactly what you needed. But if you're over 60 and you have any history of high blood pressure or heart disease, certain decongestants deserve a serious second look. I'm talking specifically about the ones containing pseudoephedrine or phenylephrine. Check the label on your cold medicine. These are common ingredients. Here's what they do in your body. Their job is to shrink the swollen blood vessels inside your nasal passages so the congestion clears. And they do that job well. The problem is, they don't stay in your nose. They travel through your bloodstream, and they constrict blood vessels everywhere. When blood vessels throughout your body tighten, your heart has to work harder to push blood through. Blood pressure goes up. And for someone whose blood pressure is already being managed, this can cause a spike that's difficult to control. On top of that, these ingredients are stimulants. They can speed up your heart rate and, in sensitive individuals, trigger irregular rhythms. The danger is that cold medicine doesn't feel like heart medicine. People don't read the label the same way they would for a prescription drug. It's just something you grab off a shelf. If you have high blood pressure, heart disease, or you're taking heart medication, please read the label on any cold or flu remedy before you take it. Better yet, ask your pharmacist. They are an incredible and often underutilized resource. Safer alternatives for nasal congestion include saline rinse kits, corticosteroid nasal sprays, and steam inhalation. They're gentler, and they don't carry cardiovascular risk. This next one is a category of medication that most people haven't heard of by name, but they or someone they love may be taking it. Tricyclic antidepressants. Medications like amitriptyline and imipramine. These are older antidepressants, and while they're not typically the first choice for depression anymore, they're still prescribed fairly regularly, particularly for chronic pain, nerve pain from diabetes, and sleep difficulties. The concern with these medications in older adults is very real, and it comes from multiple directions. First, they can cause a sudden drop in blood pressure when you stand up too quickly, a condition called orthostatic hypotension. You may have experienced this yourself at some point, that dizzy, lightheaded feeling when you go from sitting to standing. In a younger person, it passes quickly. In an older adult, it can lead to a fall. Falls, as you may know, are one of the leading causes of serious injury in people over 65. Second, these medications affect the electrical conduction system of the heart. They can alter the signals that coordinate your heartbeat. In some cases, This increases the risk of arrhythmias, irregular heart rhythms that in their most serious forms can be life-threatening. If you or someone you care about is taking one of these medications, this is not a reason to panic. Many people take them without significant problems, but it is absolutely a reason to make sure your doctor is monitoring your heart rhythm and blood pressure, and to ask whether a newer, safer alternative might work just as well for your situation. Mental health matters enormously. Treating depression and managing chronic pain are critical to quality of life. The goal is to do both without introducing unnecessary risk, and there are usually good options. And now we come to number 1, and I'll be honest with you, this is the one that surprises people the most. Calcium supplements. The little tablets that millions of Americans take every single day because they were told, for decades, that calcium builds strong bones. That after a certain age, especially for women, calcium supplements are just something you take. Full stop. No questions asked. I'm not here to say that message was entirely wrong. Bone health is real. Osteoporosis is real. And for certain people, supplementation may genuinely be the right call. But the science over the past decade has raised a question that deserves to be heard. Here's the distinction that matters. Calcium from food, dairy, leafy greens, fortified foods comes in smaller amounts, spread out through the day, and absorbed gradually as your body needs it. Your system handles it beautifully. Calcium from a supplement works differently. You're delivering a large, concentrated dose all at once, and your body can only use so much at any given moment. The excess calcium that can't be put to work in your bones has to go somewhere. Some research suggests that in certain individuals, that excess may end up depositing in artery walls, contributing to a process called arterial calcification. When arteries calcify, they become stiffer and more prone to the kind of plaque buildup that leads to heart attacks. Now, I want to be careful here, because the science on this is genuinely mixed. Some large studies have found a modest increase in cardiovascular risk associated with calcium supplements. Others have not. This is an active area of research, and it's not black and white. But here's the point that is clear: calcium supplementation should not be a casual, self-directed decision. It should be a conversation with your doctor based on your bone density results, your diet, your cardiovascular history, and your overall risk profile. More is not always better. That's a lesson that applies to so much in medicine, and calcium is a perfect example. If you've been taking calcium supplements on your own without a recent conversation with your doctor about whether you still need them, that conversation is overdue. Let's bring it all together. We talked about 5 types of medications that, for adults over 60, carry heart-related risks that are easy to overlook. Anti-inflammatory pain relievers that can increase fluid retention and raise blood pressure. Stomach acid reducers that can quietly deplete a mineral your heart needs to stay in rhythm. Cold medicine decongestants that constrict blood vessels system-wide and stress the heart. Older antidepressants that can affect your heart's electrical system and cause dangerous drops in blood pressure. And calcium supplements that, in high doses, may contribute to arterial calcification in certain people. None of these medications are evil. Many of them help millions of people every day. The message isn't fear, it's awareness. Your heart has been working for you every single minute of your life. It deserves your attention, your care, and your advocacy. And the best way to advocate for your heart is to know what's going into your body and why. Here's what I want you to actually do after watching this video. Write down every single medication and supplement you currently take, including over-the-counter products and vitamins. Everything. At your next doctor's appointment, hand that list over and say, "I'd like to review these and make sure everything here is still the best option for my age and my health history." That's it. That's the conversation. It's simple, it's direct, and a good doctor will welcome it. If any specific medication concerns you after today's video, ask, are there alternatives? Should we be monitoring anything? Is the dose still appropriate? You are allowed to ask these questions. You deserve complete answers. If today's video gave you something valuable, a new question to ask, a conversation to start, a little peace of mind, then I have one small request. Hit that subscribe button. Every week, I create content specifically for adults who want honest, practical health guidance, without the fear-mongering, without the confusion, and without being talked down to. And if you thought of someone while watching this, a parent, a sibling, a close friend, please share this video with them. You never know when the right information reaches someone at exactly the right moment. I read comments, and I would genuinely love to hear from you. Did anything here surprise you? Is there a topic you'd like me to cover? Leave it below. Until next time, take good care of yourself. You matter, your health matters, and you deserve to feel confident about both. I'm Dr. Adriana Markson. I'll see you in the next video.